Well, it is the fifth leading cause of death in the United States, yet 80% of the cases could have been prevented. We are here at Performance Medicine in Kingsport talking today about stroke. And we are here with Dr. Rogers, our daytime doc. Dr. Rogers, thanks so much for having us out.
It's a pleasure.
Well, certainly an important topic today when you're dealing with the fifth leading cause of death here in the United States, and that's talking about strokes.
Right. Well, everybody worries about heart attacks, but a stroke is really a brain attack. You can closely correlate brains with hearts. The same factors that cause your heart disease cause brain disease, and certainly you do not want a stroke. Strokes are very debilitating. If you happen to survive a stroke, 2 out of 3 have a permanent disability from that stroke.
2 out of 3 will live with the disability. And you said sometimes that can be it can actually cut off the body movement on your right side.
Right, it affects vision, speech, movement, thought processes. It's really very debilitating and hard to see.
And we talked a little bit about how 80% could have been prevented, and you were saying part of that is really taking a look at your arteries.
Right. Well, prevention, you have to, of course, look at your blood pressure, your cholesterol, make sure your diabetes is controlled, make sure you're losing weight if you're obese, you don't smoke. Some people may want to take a baby aspirin for prevention. It's in fact, more women are affected than men with strokes, which is very surprising, but very true. How can you prevent it? Another thing that we're doing here, we have a diagnostic ultrasound machine, and we scan the carotids and the vertebral arteries to look for emboli and plaquing, and that's a very good correlation or a predictor for whether or not you're a risk for stroke.
So tell me how that works, because you were saying it's very non-invasive.
It's an ultrasound technique. You use an ultrasound machine with a kind of a head that you rub jelly on the neck, and you look. We have a sonographer doing this. It's been doing vascular things for about 15 years. So she's able to do a very diagnostic test to see not only your carotids but your vertebrals. There's several arteries in here that you worry about, and give a very accurate picture of whether or not you have anything to worry about.
And something like that, you said the price point on that.
Well, we're doing for $85, which is just a bargain. It's a several $100 test, but because we do cash, we don't fool with insurance companies, we can do it pretty inexpensively.
And what a great way to come on in and make sure that if this is clear, then that's a good sign, and if it's not, could be something that you need to make some changes to protect yourself.
Exactly.
Well, certainly a great topic, and again, they can call your office to schedule an appointment.
Sure.
All right, well, here is the information. It is Performance Medicine in Kingsport. For more, you can always check out their website or give them a call, performancemedicine.net.